Hi, my name's Tali. I'm a clinical psychologist and the director of the Stanford Translational Anxiety Research Lab at Stanford School of Medicine. The lab's mission is to use what we know from neuroscience to improve the understanding and treatment of anxiety disorders. And one project is called Using the Neuroscience of Fear Extinction for Anxiety Reduction, or UNFEAR. Through UNFEAR, we're aiming to improve exposure therapy for social anxiety, which we know is a gold standard treatment, by linking exposure therapy to a lab procedure called extinction learning. Exposure therapy was originally developed through research on extinction learning, and the idea is that when someone's repeatedly presented with something they fear, without any negative consequences happening, they learn that what they fear may be safe after all. When we study this process over a few hours in the research lab, we call it extinction learning. And there's a common assumption that when we do exposure therapy in the clinic to help people with anxiety disorders face what they fear, that's over the course of weeks and months, we assume the same process is taking place. So in other words, there's a common assumption that extinction and exposure are the same thing. But it turns out there's limited data to test that assumption, and that's where the UNFEAR study comes in. In the UNFEAR study, we bring in adults with social anxiety disorder to the lab to complete the lab version, extinction learning. We collect verbal ratings of how they feel, skin conductance to measure how their physiological arousal systems are responding, and use functional magnetic resonance imaging, or fMRI, to measure how their brains are responding. We also have our participants come back a week later, so we can see how strongly they remember what they've learned. Once this part is complete, our participants are randomized to get a structured exposure-based therapy or be put on a wait list. And at the end of the treatment or wait list period, we assess their clinical symptoms to see how well the therapy worked for each participant. I think this type of work is so important because even though exposure therapy is one of the best interventions we have, as many of a quarter to half of patients who complete a course of exposure therapy don't get all the way better. So in order to improve outcomes from exposure therapy, we're using research like the UNFEAR study to see whether we can predict who will be most successful with the treatment. In other words, we're trying to see if information we collect on how each person's brain processes what's scary and what's safe helps us understand who will be most successful with exposure therapy. Plus, there have been so many exciting findings from neuroscience on brain systems most important for extinction learning, like the amygdala, anterior cingulate, and medial prefrontal cortex. So I think it's really exciting to be able to leverage this work for much-needed clinical applications. For example, we know that activity in the ventromedial prefrontal cortex predicts whether rodents will remember what they've learned through extinction. But in the clinic, we don't yet have a good way to know whether the person in front of us has learned what they most need to learn. So the thing about doing this in the lab is we can see what the learning process looks like, test what we can do in the lab to make extinction learning, and therefore exposure therapy, even more effective. So as a clinical psychologist, I just love being able to bring the tools of neuroscience to improve the lives of people with anxiety disorders and to connect my science with clinical